of their opinion and are not intended to malign any religion, ethnic group, club, organization, company, municipality, individual, or anyone or anything.
He's a surgeon. He's a 100-ton boat captain. He's a lieutenant on Seaside Heights Beach Patrol in New Jersey. He's a member of the Coast Guard Auxiliary. He's Dr. Michael Kachmar. Need answers to your medical questions? We have them. Listen in to hear latest on medical topics related to all that and more.
Hello, everyone. This is Dr. Michael Kachmar. Welcome to Scrubbing Up with Michael Kachmar, or Dr. Michael Kachmar, as I'm known. Today's date is February the 8th, the year of our Lord, 2024 AD.
It's not 25 yet?
No, 25. I thought I say 24.
You said 25.
I'm sorry,
Yeah.
20.
We just traveled back in time, folks.
Yeah, so it's 2025. We have Jeremy. Jeremy wants to say hello to our audience.
Hey, everybody. I'm your old pal, Jeremy. You know that. Yeah.
So, Jeremy, can you just throw up our webpage? While I'm doing this, I'm going to go here. I'm a board-certified reconstructive foot and ankle surgeon. I've been operating for over 30 years. I'm on staff at multiple hospitals. Right. I'm board certified in reconstructive foot and ankle. Over the years, we did a lot of pediatrics, a lot of trauma. Yeah. And this is a show, it's medical, some political, because medicine and politics, collide. Today, we're not going to really talk about much politics. We're going to talk about a product that we have in our office, which I tell you is just really unbelievable stuff. But for anybody who's out there on the podcast, our webpage is JerseyShoreFootandLegCenter.com. JerseyShoreFootandCenter.com, and go there, and it's chock full of information. Right. We're on Facebook, also, YouTube, Twitter, Twitch, Rumble, and you can go watch this. And we're on Spotify and all the other things. Jeremy, you want to throw, and also, just do the other to call us in the office. So the office, if you want to make an appointment, is 732-269-1133. Obviously, we're in New Jersey, Jersey Shore area. We have several offices, so you could come and get us and talk to us. So today, Jeremy.
But before we go
on. Yeah, go ahead. Sure, Jeremy. What's up?
Please, guys, if you can like and subscribe where you see us going live, like on our Facebook page, on our YouTube page. That's when you're going to get notifications for when Mike and I do go live, and you can join in on the show. You know? That's it.
So what we're going to talk today, we're going to speak about is this. We have this company idea, what is called EBM, which is evidence-based medicine, and it's a place. It has a lot of products, but we've been using for years prescription medical food. And so you might have the question, what is prescription medical food? So why don't you go to my iPad there. So here it is right here on the screen. What is prescription medical food? And I'm going to give you a description. So medical food, as defined in Section 5B3 of the Orphan Drug Act, 21 USC 360 EEB3, so that's the code, for the statute. A food which is formulated to be consumed or administered internally under the supervision of a physician and which is intended for a specific diet. Okay, so it's a prescription, and it goes in here. FDA considers the sanitary definition of medical foods to narrowly constrain the type of products that fit within this category of food. So, you need somebody who, like a physician, to prescribe it. And it goes here a little bit further. Medical foods are distinguished from the broader category of foods for special dietary use by the requirement that medical foods be intended to meet distinctive nutritional requirements of a disease or condition used under medical supervision and intended for the specific dietary management of a disease or condition. Medical foods are not those that are simply recommended by a physician as part of an overall diet to manage the symptoms or reduce the risk of disease. So it's not a prescription medicine where you have to like I give you for morphine or a Percocet or an antibiotic or one of those. That's different. Right. That's a prescription you get at the regular pharmacy. Also, this is not the same as supplements where I say, go take some vitamins. go to the store and get some vitamin A, vitamin B. Although this is vitamins in here and other things. So it's a totally different scenario, you see. So this is a very broad situation. Now, just hang in there for a minute. Don't give me. Okay, I didn't want you to go back yet. Just let me find what I have to find here. So so there's criteria. You can go back to my screen now, Jamie. So we're going back and forth. So here this is medical food criteria: specificity, formulation, dietary management, medical evaluation, supervision. So you have all of these. Each medical food capsule, what we prescribe is vegan, it's allergy-free, dye-free, and gluten-free. And so it goes in a whole kind of thing here. So you could go back to me.
Okay.
So what do we have in the office? We have several products that we deal with. And I'm telling you, I've been using the one.
You got them here?
Well, I have the brochure. So,
brochures?
but I want to show it. Yeah. The one, and I could probably show it on the camera here, but for diabetic neuropathy, all right? Diabetic neuropathy has been around for a really long, long time. And it's been an issue for a lot of people.
Oh, yeah, for me too.
And I'm going to show you here. I'm just going to put this up here.
I just got it under control.
Yeah.
Where it's not keeping me up all night, the pain.
Right. So
because my diabetic neuropathy, it feels like a potato peeler peeling off the top of the skin. On
so
my
get
foot.
rid of. So if you could see here, we have the brochure. I'm just holding up here, and this is metformin, which really causes a lot of issues. Metformin, and
and unfortunately, I have to take that for my diabetes.
Right. So what we put people on for the neuropathy, and I know we talked about you for a while, and there's a lot of things out there. You could take gabapentin, which is has a lot of side effects. Lyrica, which is pregabapentin. But the product that we use here.
Does Ozempic help?
Not should be for neuropathy.
Not for neuropathy.
But what we use here is a medication. I've been using this for years and years, and it's methylfolate, which is an activated part of folate. So I'm going to give you the brochure here. And this is it here. And if we zoom in here, you can see that's the ingredient. That's the ingredients right there. And it's amazing, what we're talking about. This helps with. So what happens with diabetes is that everybody ingests folate, and the folate does not get processed by the nerve cells, and you get neuropathy. That's some of the theory. So what we do is we add. We take the folate and they do it in the laboratory and they activate it. So now you have ethyl methylfolate, which is activated, and it makes a big difference with neuropathy. I've been prescribing this for probably 15 years to patients, and I can tell you the improvement is unbelievable. The price is probably about $40 a month. The insurance doesn't cover it, and most people, once they get the relief that they want. They don't really care.
I mean, $30 a month is nothing for that kind of relief. If you want to get these brochures yourself and look them over, and have somebody actually, or Dr. Kachmar actually talk to you about them, you got to call and make an appointment. It's 732-269-1133.
Okay, go back to my video. So I'm going to show you these things on the internet. So here's this is the one that I prescribe for. This is vascular and neurotropic conditions. This stuff is great, and I'm going through here.
This is like the book you just showed us.
Yeah. Now, I just wanted to show it out there. But so here it is. Here, of course, it talks about medical food, but here is talks about the nerves and how it helps. And again, everybody should go and look at the YouTube video here. I have it up on the screen, and it's very, very helpful. And I'm going to go down here. Metformin. There's actually metformin is a drug that's given to diabetics to reduce their sugar. There is a black box warning for metformin where it reduces the B12. So the manufacturer recommends that you supplement yourself with B12 if you're on metformin. Low levels of B12 could cause neuropathy. Okay.
Well, I added B12 to my daily regimen. So.
Right. Well, we talked about putting you on this. I put one, but so now here there's a whole thing. This is really the key here. See, if you look on the right-hand side here, it says biofolate. The patented pure crystalline activated form of folate is unaffected by the MTHFR. So here you have biofolate that goes into L-methylfolate. Here's what happens. On the right-hand side, you have folic acid that you take in. There's 1, 2, 3 different processes that happen in a nerve, and it gets blocked. This is the genetic variant which is also another issue. And then it doesn't make the L-methylfolate. So that's another reason. There's a lot of...
So naturally, it does not make that
no.
L-methylfolate.
So they're saying there's a genetic variant, but it seems, in the way I understand it, the diabetes is part of the problem too. But for diabetic neuropathy, this stuff really works well, okay? And you could study this. I recommend people, go onto our webpage or give us office a call or go to this webpage here. It's EBM, evidence-based medicine. That's the name of the company, EBM.com, and you can look at it. So, Jeremy, let me just see here. So here's some other. So we're just going down here. There's different products here. We give them in the office. So what you do is you come and see me. I'll do an evaluation whether or not you have diabetic neuropathy or not. There may be blood work, maybe X-rays, maybe other testing. Rule out Lyme's disease. We rule out. Any other disorder that could be causing this neuropathy, spinal stenosis, nerve damage in the back. Yeah. And that's really a challenge a lot of times. We'll get people who have spinal stenosis and nerve damage in their back and also diabetic neuropathy. And it's hard to tease out which is causing most of the problem. You have a dual problem. You have a structural problem as well as the...
Right. It was very difficult to diagnose my diabetes because of the spine damage I had.
Right. So let me show you some other products here. Let me just go here. So we're going to go here. That was for the food. I'm going to give you another one here. Let me see here. The brochure. Just give me 1 second, Jeremy. Just stay there. Yeah. So when we have also now one that we use also, which is really good, is for inflammation. So let's just say you have chronic pain. And you are diabetic or not, you have issues with your kidneys or your heart, taking a naproxen and those anti-inflammatories are really not healthy for you, and they could cause a lot of issues. So what we have is this. It's called EB-A7. So this is for chronic inflammation. Okay. So this is metabolic management of pain and inflammation associated with osteoarthritis. So this is a medical food. It's a lot safer. In fact, way safer than naproxen or Aleve. You can't be taking that, even Tylenol. So what we have here, you can look at the ingredients. Turmeric. See the turmeric? Yes, 95%. Yeah. That stuff is really good. That's an inflammation, pain, and stiffness. You have this SAM-E, inflammation, pain, and stiffness. It goes down. There's 1, 2, 3, 4, 5, 6 different things in this tablet, and it's all safe. Now, let me tell you, what happens is you come into my office, I give you a script, it's a little piece of paper, and the pharmacy calls you. You actually talk to a pharmacy rep or a pharmacist, and they'll go over a list of your medications, and they'll evaluate whether or not there's an issue. So and I'll show you the page.
This is great. This how many people out there have just grabbed bottles of vitamins or whatever?
Yeah, this is
I mean, here, Dr. Kachmar takes away the guesswork, and he tells you exactly what you need, and the pharmacist will back it up. I mean, you can't really go wrong, can you?
No, and I'll tell you one product that I write scripts for like 5-6 times a week.
Yeah.
So people come in with these dystrophic nails. Their nails in their feet, or they funny looking, they're discolored. Some people have fungus, but other people, it's just from trauma, from running all their lives or getting older. So this product here is really good. So this is a metabolic solution for brittle, discolored, and irregular nails. This product is really good. And again, it's a medical food.
And is it true that the older you get, the more
yes.
likely?
Yeah. Oh, yeah.
Because I remember my granny, and she had some problems with her toenails and her, the ones on her fingers. So this would have been magic for her.
So we do this, and we also have a topical, and it's one capsule a day. So if you get a script, here's how it goes. So now I'm going to read this is product information, patient information. So it says, now that I have been prescribed an EBM medical product, what are next steps? So your provider, this is what we do. Your provider will send your prescription to EBM Medical, okay? You will receive a text or email to confirm your order, right? And then an EBM representative will contact you to answer your questions and process the payment. And it's free delivery, And again, when you're on the phone, you could talk
and
to.
you'll get this within 24 hours? Are you
Oh,
kidding?
yes.
Wow.
Yes, it's really good. So I'll tell you another product that we have. We're not going to go through all the products because they're just,
There's just so many, and they're so
but
good.
these are the ones. So I use the one for the brittle nails I give patients. I use the one for the diabetes who have the neuropathy. That's by far our biggest prescription.
Yeah.
We got the one for inflammation. That's another big one. And then the other one that I give to patients too is, I'll show you here in a minute. And again, it's all, there's so many different things. You have to really get the patient in and do a comprehensive exam and figure out what they want. But we also have a plantar fascia kit, which is pretty interesting. But
Really?
Yeah. There's one more I just want to show you here if I could find it. I guess I can't find it here. But it's there's one, there's a really good one here too for immune system, by the way. And I think during the summer, it's a great idea. And let me just find it here. So diabetic wounds, all these different products here, Jeremy, that you could take, which is really, really helpful. And I'm just trying to find the one here. There's one for immune system, and a lot of people, I think, during this time of year, would probably benefit from. I take it, and so let me just show you what it looks like.
Right now there's bugs going around, and it's knocking people off their feet.
Right, and this stuff shouldn't
I just had it this past week.
Right. So this is optimize and maximize immune system response, improves defense function. It goes on and on here. So what this has in it, and again, we have it on the screen. It's a whole slew of different products in here. Again, this is all, safe, FDA approved, and again, this is high end stuff. It's really good, and it's not that expensive, Jeremy. Yeah. That's my response. Just go back to me while I do this.
Okay.
So so if you were a patient, what would you think about all this? It sounds pretty neat, right?
Well, it's great. I mean, when you get to an age, I'm 50 now, and I'm starting to realize I gotta do special things to keep me going, and so I'm adding these vitamins. I'm adding these little things to my daily bunch of pills I have to take, just to keep me functioning and functioning well. So yeah, this is brilliant.
It's a good product. Like I said, I've been around. I've been using this product for quite a while, and we've been doing medical food, like I said, for at least 15 years, especially with the diabetic neuropathy.
Like I just got this bottle of pills, it's L-theanine.
Yeah.
L-theanine. It's like an enzyme that your brain can't create, but it helps you with, amongst other things, insomnia. But it makes you more clear-headed and ready for anything. And you know what? I heard about that on YouTube, and that ain't a great place to hear about this stuff. Going to Dr. Kachmar, and he spends the time to find out who you are, what you need, and then he prescribes this stuff for you. I'd rather have that kind of knowledge backing it up rather than a YouTube video.
Go back to the screen again. So here's
I'm right though, right?
Yeah, no. So this is medical food regulations. This is another, because a lot of people get hung up what this is. So medical foods are considered a unique category regulated by the FDA. Medical foods can help manage chronic conditions by addressing the metabolic deficiencies associated with the disease. You understand? That's what it's doing. They're intended for use under medical supervision. So if you see here, medical foods is in the middle. This diagram shows to the right is prescription drugs and over-the-counter drugs. Right. So prescription drugs, antibiotics, pain meds, it goes on and on. The other side of the coin here, the other side is over-the-counter vitamins, functional foods, all that. This is totally different. And so here's some examples, specifically for management of distinctive nutritional needs resulting from a specific condition. Patients who cannot normally take or metabolize ordinary food, or those dietary needs cannot be met through normal diet. A lot of people, again, with diabetes, there's people out there, there's papers written that you cannot function or deal with or absorb vitamin B12, and then also the folic acid, you're not activating it. Right. Also, people with gastric bypass. Usually, people with gastric bypass, the doctors put them on a really good regime. But whatever you're on, you should contact us, or you could go on. You go to EBM, and they'll give us our information. They'll give you our information. You have our information. You tell them that Dr. Kachmar is your physician, and then they'll recommend stuff, and then you could tell the doctor who's giving you the supplements. You could even go here and ask that doctor to sign a script. But give us a call. And we'll talk about it. Put our number on the show here for if anybody wants to call. We just started with the phone again, so. I think it's all the way down here, right there, Jeremy.
Right there.
So if you want to give us a call here, either this show or any show, you might want to write this down. It's 732-237-4949. And you can give us a call, and we could talk about, you could have any questions, we'll definitely help you out.
Yeah.
So here's a great, not ready to register online, download order forms here. This is for us. This is doctors. So anyway, that's what it is. You understand the concept. Yeah. There's a lot of good products. I really recommend, this to our patients. It really helps a lot of people. And I didn't even, like I said, there's 100 different products here you could go through. I didn't even go through all the stuff, but the ones that I showed you, I really use. There's ones for when we have bones, when we do surgery, healing bone. We recommend it.
But this seems like the one-stop place to go, where you know what you're getting is going to do the best for you.
Right.
Instead of just saying a bottle that only has, say vitamin B12, for instance. This has a lot of stuff else that's in there that backs up that, or more. And you're getting it from a well-trained doctor. That's important. That's really important.
Right.
Because supplements, people grab them and they don't know if that's the right thing for them or something like that. So having a well-trained physician who is going to talk you through it and guide you along the way until you get those supplements the very next day, that's amazing.
Yeah, and like I said, if you have a physician who's treating you and giving you supplements, you might want to ask them about this product. They could always call us. And actually, I have to get a way where if that doctor, though, we could give you, you could get the phone number and you could call them directly.
Sure.
And as long as the doctor's giving a script, we'll deal with that. I'm trying to work with the company where if you're being treated by another physician, we could certainly help you out, and do it that way. All right, well, I think that's really, we didn't want to go crazy today about a lot of stuff. We're short on time. It's how long have we been in the show? Can you just go up into the screen here? So, okay, we're almost another 10 minutes. So don't stop it. No,
I just wanted to check if everything was running.
Yeah, you could hit that. Go ahead if you want. So anyway, I'll go here. You look at it. So Jeremy's just checking our live stream. We're streaming all over the place.
Yeah.
How about this? We just end this we got a little time now. We don't have to talk about this anymore. First of all, do you have any questions about this stuff, Jeremy?
No, this is brilliant. All they have to do is call 732-262-11...
No, 269.
269, forgive me. 732-269-1133. That's 732-269-1133. And Dr. Michael Kachmar will walk you through everything you need to do so you can be sure you're getting the right supplements that are going to work for you.
Right. So let's... I've been away, so let's just talk a little bit. I've been away for a week. I went sailing down the Caribbean, and it was beautiful.
That's your passion.
Right. But let's just. I really haven't heard too much about the politics. I haven't been watching it.
Me neither.
Because you know what? But
I was sick this past week. I didn't want to know anything else. Yeah.
But I've been following the medical stuff and medical care, and what's going to go on. I did post on my on X and also Facebook.
Okay.
If you want to go there, several of the things that happened with the Biden administration. So you have straight Medicare in this country, and then you have Medicare Advantage plans. They cut the event. What's the matter, Jeremy?
I'm saying you don't want to get blocked, so be careful what.
Oh yeah, no. They don't worry about it. Yeah, they get blocked all they want. They that's another thing people out there don't realize. They're censored still.
Yeah, we have to be. We were stepping on eggshells over here.
So, but no, this was an article. I mean, this is what they did. They over the 3 years Biden administration, they defund or lowered the prices that were being paid to doctors for
I like defund.
You know,
That's
medical.
it.
So for Medicare Advantage plans, at the end though they did give an increase, but you know, so there's a battle going on right now. I don't know what Trump's going to do, but a lot of Americans, they either have Medicare or they have Medicare Advantage. Medicare is a straight direct access. Usually, what you do is you give up your Medicare and you get Medicare Advantage, which is a private company administrating the care. The government pays for it. And traditionally, you know, the argument was it's not equal, and you know. So I think what they're going to do now is really fund and try to streamline and the Medicare Advantage programs to be really robust and give you a good product. We'll see. The problem is they have to reimburse the doctors. The doctors' fees are going down tremendously, and where they're not covering things. And I'll give you a good example.
Advantage is not covering things.
Everything, all the insurance companies.
Yeah.
Affordable health care has really put a kibosh on reimbursements.
Do you get a lot of patients with Medicare Advantage?
Oh yeah.
You
Oh,
do?
tons.
And you're getting.
Well, I'll give you an example.
They're getting what they need, and you're getting what you need.
No,
No.
absolutely not.
Yeah.
If I get a patient who's say 70 years old and they have straight Medicare,
Yeah.
and they come in and I have to evaluate them for an office, and I from the office visit I get about $120.
Right.
Okay, with the Medicare Advantage I get 60. A lot of them. They're all different ones, but it gets almost
But
half.
with Medicare Advantage, it's a crapshoot as to whether or not you're going to be getting what the doctor thinks you need. They make up their mind, and you get what they want.
Well, what happens is just think about what work you've done, and anybody out there listening to me.
Yeah.
If they pay you 50% less than what you used to get, you're not going to take that plan. So a lot of doctors don't take the plan. A lot of doctors will, that's why they have nurse practitioners, or you got a short, you're in the office, they talk to you for 2 minutes. It's time is money. And so I'll give you another example. What happens so I was a first assist with general surgery.
Yeah.
As a foot and ankle specialist, state of New Jersey allows me to be a first assist. So when you do gallbladders, for instance, gallbladders need is 2 doctors. So I could help as a first assist, be like a PA. Mm-hmm. Well, gallbladder 15 years ago used to get about $3,500 for a gallbladder. That's what the doctor would get to perform the surgery. A lot of times it's at late at night. People have a acute gallbladder attack, and you don't get paid any for 90 days after that. Well, and I would get 20% or 10% as an assistant fee. Now, you know what a doctor gets today for a gallbladder, a Medicare patient for gallbladder?
How much?
$600.
See, everybody out there thinks these doctors are rolling. Oh, you just want to get rich. Well, they're not getting rich anymore.
Here's the thing with medicine, which is kind of scary, because now I'll take an orthopedic surgeon, and there's a lot of them. Used to be you'd make $1 million, and you could say, well, that's just too much money. But they did a lot, and these guys were smart, and gals were smart. Now, you're making $250,000, $300,000. You say, oh, that's a lot of money. And you go on the internet, and you say, oh, they say more than that. No, it's bullshit. There's some people who making big money. Yeah. The nurse practitioners, nurse anesthetists are making, up to $200,000, maybe $250,000.
Yeah.
So. Getting back, what's happening is if you don't pay the doctors well, they're going to leave. I know endocrinologists are packing it in because they just can't make enough money, and they're old enough they retire. There's there's no if you're and you got the people who are still doing well, or are doing procedures, a lot of surgery, and they have a surgery center, so they get a fee for the surgery center that they own. But now think about it: if you come out of school, you owe $300,000. Let's just do a scenario. You're an orthopedic surgeon or a podiatric surgeon. You need $400,000 of student loans. Now you got to open up. You either buy into a practice or you open up your own. You got to get a salary, and they're going to want you to produce. You're going to have to see a certain amount of patients and do a certain amount of surgery. A lot of places, the surgery, you get a percentage of the surgery. So is there a bias or is there an inclination to do unnecessary surgery? Just you got, what I'm saying. You got to pay.
That's the importance again of
you got to pay
the second opinion and the third opinion and the fourth opinion. But you need to make sure you're with a surgeon who is going to do you the right way, do you well.
Right,
Because there are surgeons out there that, they
No.
yeah.
But I'm talking about, but even, yeah, that's absolutely positively right.
Yeah.
But even the guys who are really, gals who are really good they're not making enough money. There's not. They're going to go to other places, and some of the best and brightest, there are people who definitely want to be doctors. They're going to become a doctor. Yeah. But if you're really sharp and you don't have really a lot of money and you want to have a successful career, have a family, have a nice house, you're going to go a different direction. And right now it's really bad out there. I think that Affordable Health Care, what the Affordable Health Care Act did was put corporate America into medicine. So the doctors are losing the income, and it's going towards the hospitals, it's going towards the pharmacological companies, and also the people who make the equipment. I did a case, I don't know, 2 years ago before I got injured, and it's called a triple arthrodesis. And I get paid about maybe $1,200. It's 2.5 hour surgery, like 2 hours. You know what the hardware cost? $10,000. When you do a spinal surgery, the hardware, Gabe, when Gabe can't fix him anymore, and he sends him Dr. Jasper sends him to a back surgeon. The hardware, what the company gets, who supplies the hardware, could be up to $75,000 for one case. The doctor used to make like $20,000, $30,000. And those days are over.
Those days are long gone.
Right. So it's becoming a real issue, and I bring it up because right now Trump's in power, and I don't know where medicine, even with the Biden administration, that wasn't a big hot topic issue. Medicine, everybody thinks they talk about the Affordable Care Act, but the Affordable Care Act, you got to remember, if you don't pay the doctors and the nurses and the PAs and everybody else adequately and appropriately, several things are going to happen. They may not, you're not going to get maybe the quality of care, or you're not going to get the time. It's not going to be, the quality might be there, but the niceness and the patient-doctor relationship, they're going to blow you out of there real quick. The other thing is you're going to have doctors, because of economics, are going to start maybe cutting corners or doing maybe surgery that's not necessary. I certainly wouldn't do that, but I've seen it. I've seen it firsthand.
Sure.
Then the other thing that's going to happen is your best and brightest are not going to go into medicine. So now, and with this affordable health, with the last administration, they were lowering standards all over the place. The diversity, all of that. So and then that's what you get.
Yeah.
So it's going to be interesting to see.
When we say diversity, it's not like if you're a different color or a different race, that we don't want you in. We want in the people who have knowledge, not just because they're diversive. We want people who are well-trained, who know what they're doing, and anyone can, hey, that's, who doesn't want, somebody once said, who said it? When you're on a plane, right? You don't think, oh my God, I hope the pilot's diversive. No, you think,
just want to know if they're qualified.
You want to know if they're qualified and that they can do and get you there safe. That's what you think, and you don't care what color, race, creed, whatever they are.
Yeah, listen. My flight when I went out, it was a woman up there. She had gray hair. She looked like could have been like my auntie. I mean, she was probably. I guess she can't be over than 60, but she was probably in her 50s, right. And I think she sat in the left seat, so she was the the captain. Yeah, no, left seat is the pilot.
Left
so
seat
in a plane, left seat's the pilot, the right side is assistant pilot, co-pilot.
Right.
We call it co-pilot, and
then behind them they got a guy, right?
No, that's a big plane. Not in this plane. No. It's
I'm
just
only remembering from Airplane.
No,
the movie.
You're watching the movie. Yeah. But no, when you it's interesting because they talk about these visas, H-1B visas, and there's a lot of very excellent doctors. They're Indian. They've second generation, third generation, and they seem to be. When I did my training and I went into medicine, it was either doctors were mostly Jewish, a lot of Jewish doctors, and some Italian, and so it's changed.
Indian doctors,
Indians now there was some, but now there's a lot. I don't know what the number is. I would say maybe 30%, maybe 40%, but I mean they're well trained, very good.
Yeah.
I'm not suggesting that they're there's all kinds. There's a lot of women now. I bet you there's 50% women in medicine.
Yeah, yeah.
I know. Dr. Schneider. She's been a breast surgeon for years. She's excellent.
Yeah.
I mean, the one
she was a female doctor back in the day when females didn't get the respect they needed, or should have had.
The premier heart transplant doctor up in Newark, Beth Israel, who operated on Dr. Kadersha, and she's a woman, obviously, and I think she might be Filipino, but she's one of the best, and I think part of it is she got those small hands, she could really, because but unbelievable. So you got women fighter. The mentality is great. I think that in medicine, but yeah, no, the diversity is fun. But what happened though is you don't want to lower the standard, and right now with medicine, it's the money's not there anymore, and they need to fund it. So where medicine is terrible is like in England. Right now the National Health, they are not funding medicine as well, and but you do have private entities that evolve. So anyway, I think it's still a good profession to get into. Don't get me wrong.
Sure. But
I think I'm optimistic with the Trump administration. I hope somebody along the line does something. Now, I don't know. Did Robert F. Kennedy Jr. get confirmed?
Yeah, I think.
Did he get confirmed?
Department of Health, right?
Yeah, but did he get confirmed? Though?
I'm not sure 100%.
All right. Well, maybe if he gets in there, hopefully, he'll do something.
If he's in there, right, we're going to be a damn sight better than Anthony Fauci. I'll tell you that.
Yeah. Is there anything else you want to talk about, Jeremy? Because we're gonna. I want to round back to this, medical foods for a minute.
It was good seeing you after your holiday.
Oh, yeah.
And it's good to be back on the air.
Yeah. I wanted to show. There was actually a video here. I was trying to pull up here, and I just can't find it. But it talks about what this is all about and ease of service. There was like a little video, but let me just. Just go. Can you go back to the video here for me?
Thing.
So I just want to end it with this. So the product that we
sum this up again.
right. So the product that we talked about today, the company is EBM, and that's evidence-based medical medicine, and it's a medical company. It's the products. So EBM has your back. This is care services. What they want to try to do is manage high out-of-pocket expenses. They keep the fees down. It's a medical food program management.
Because that's important for all of us.
Right, they get delivered. So
we don't want to break the bank on
stay
one
current
thing.
with your medications.
Yeah.
They go all you'll have a pharmacist talk to you about it. Flexible medicine delivery options, automatic delivery. I mean, it's voyage services, packing solutions. I mean, it's really they really are amazing company. And so here they have flexible budget billing programs. So let's just say you want to get on the medication. They'll let you bill, so you could get the product, right? And they'll give it to you for like 3 months worth of product, and you pay it over every month, off your credit card. So it might say it's $40 a month. You'll pay this month $40, but you'll get 3 months product, and then you just pay, every month you pay the $40. So whatever it is, contracted medical portfolio. I mean, it's really, really a good product, and education. You could really check this out. I just wanted to see if, find a provider. And you could go on this webpage here. So I want to end it with this, Jeremy. Go to me. This product, if you really want to know about it, you could give us office a call. You could, let us know if you're interested. You could come in and see us. I really like to see the patients who I like to see, Jeremy, the ones who have diabetic neuropathy, because we could really, really, really help you people. And also, the second one would be the nails that are dystrophic, discolored. We do a biopsy of a nail. We send it out to the lab. Yeah. And then what we do is, depends on what we get, we could either put you on Lamisil, which is a prescription antifungal medicine, it's oral pill, or if it's secondary to trauma and not fungus infection and bacteria, we put you on a topical. It's called N45, and then the capsule for brittle nails works excellently. We have the chronic for inflammation. It's a very safe drug, and I would definitely try it. Listen, what I tell people, you come in, say you have chronic ankle pain, leg pain, you take Tylenol all the time, you take an Advil, or whatever the pain is, try this stuff. It's safe. try it for 3 months. If it doesn't work, then don't do it anymore. You're out maybe, a couple $100, maybe not even that.
Even that.
Not even that.
Not
It's
even
cheap.
that.
It's not that bad. And we strongly recommend it. The other ones I use, again, for bone health, if we're doing surgery, we like to add this on.
And how many pills come in a bottle?
I don't
that's a
know.
good
I
question.
think it's 30 days. I think they what they do is they give you it's a 30-day supply,
Right.
and then you could get 3 months of it. I recommend with the diabetic neuropathy, I recommend trying it for like 3 months.
3 months. 3 months for I think you said $30 to start with, or around that.
It might be 40, but
Might be 40. But that's 3 months. So
no, so it's 40 a month. But here's the thing.
Okay.
I think that's the price. But I've been using that for patients for 15 years. This
Gotcha.
medical food for diabetes,
Gotcha.
and when it helps them, they're happy. If you want to say use your prescription, I could give you Lyrica or gabapentin, which is Neurontin. That stuff works too, but it's a anti-seizure drug, so it makes you dopey, drowsy.
What, gabapentin?
Yeah, oh yeah, it could. Yeah, oh yeah.
I'm on gabapentin.
Yeah, I know you are. That's why your
Yeah.
neuropathy is good. That's right. I didn't want to talk about it because I don't know you personally.
Oh,
But
no.
yeah, no.
I'm an open book.
So what I do is I
Yeah.
take people off of the Neurontin and the gabapentin. Neurontin is gabapentin, and the Lyrica, which is pre-gabapentin, and try to switch them onto this stuff.
Right.
This stuff is really good, and we do a lot of those patients. But yeah, the other stuff has definitely side effects. Especially it could be depressive, stuff like that.
Yeah.
So anyway, I just wanted to throw that out.
We were just talking on Painless with Dr. Gabriel Jasper just before Mike and I started this show, and Dr. Jasper and I were talking about negative affects in your mind and your brain, and how you got to keep positive.
Yeah.
You got to keep positive.
So Jeremy, tell them where they could call us for an appointment.
Yeah,
you got it up already.
I had it up already. Okay. So it's 732-269-1133 to make an appointment with Dr. Michael Kachmar.
My webpage, please.
That's 732-269-1133. And his website for more information, please go to JerseyShoreFootAndLegCenter.com.
All right, everyone, listen, have a nice week. Watch out for the snow that's coming in New Jersey, all over the place.
Yeah.
And we'll be here next week. So thank you very much for checking in.
Okay.
We hope you have a great day. And give us a call if you're interested in this medical food. It's really a good idea. Bye-bye.
give us a call.
Take care.
Bye-bye, guys.